highest number of people living with HIV and AIDS. It's made great strides, though, when it comes to treatment and prevention. In fact, new infections dropped nearly 50% between 2010 and 2016. Make no mistake, though, this battle is far from over, with thousands of people still contracting the virus every year. The 9th SA AIDS conference kicked off in Durban today. For the very latest, we're joined by Steve Letsike. He's the Deputy Chairperson of the South African National AIDS Council. Thank you so much for joining us this afternoon. Numbers are always a big issue when it comes to looking at the scourge that South Africa continues to fight. I saw a report, the latest statistics from the University of Washington's Institute for Health Metrics and Evaluation, and they say there that almost 1 in 5 of South African adults between 15 and 14 have HIV. That's a 5 percentage point increase from 2000. That's 17% of that particular age group. Now, some experts are saying, yes, that number might be shocking, but it's also because we have more people in South Africa who are successfully living and controlling the life that they live with HIV. Do you see that as, how much of a positive do you see that as in the fight against this scourge?
Good afternoon to you and to the viewers. Indeed, these numbers, you can say they're increasing, but however, I think we must acknowledge South Africa is implementing one of the biggest treatment programs in the world. We have over 4 million people who are living with who are on treatment. This is free treatment given by South African government. Now, what we need to anticipate in this case is that how are we then going to ensure that when we put more people on treatment, we are bound to know that people are living with HIV. Now, it's something that we need to acknowledge. But part of why we are finding out this information, it's also about the prevention program that we are implementing of 90-90-90, one of finding the HIV positives. So which means we are going flesh out across the country with various programs to getting people to know their status. And that's how we can prevent new infections. That's how we can put more people on treatment.
Now, when it comes to the figures that we continually have to look at to try and find the source of the issues, new infections are always a number that is brought up. What are the new infection figures telling us about how younger South Africans specifically are looking at the threat of HIV and AIDS?
Yeah, we do have a big problem when it comes to new infections. Of course, you know, a few years ago, if we were talking maybe in 2016, we had 2,000 new infections per week between young girls, adolescent girls and young women between the ages of 15 and 24. We've seen a slight decline in that age cohort, where we've now only seen just below 1,800 per week. It's a very slow pace in terms of that particular population. But also, what are some of the new infection, particularly for the key population, men who have sex with men, transgender population, also what we're seeing with sex workers, people who inject drugs. What we know as a country is that in our national strategic plan, we've set a target for ourselves. Our target initially in the National Strategic Plan was that by 2022, we should be below 100,000 new infections. But with consultation and engagement with the UN AIDS, you know, it has set a South African target of below 88,000 new infections annually. And that's what we need to be working towards, which means the tap of infection, of new infection must be closed. People must start to use condom. People must delay sexual debuts if possible. But people must look at preventative methods of reducing new infection. And all of this is based on behavior that South African must get to.
So where is the gap? What is missing here? Why is that message not getting through to young people and those groupings at risk, as you just mentioned?
I think Look, there has been interesting programs and pockets of excellence that we've seen across the country. The president, when he was the deputy president in 2016, launched a campaign called She Conquers, which was bringing together various programs implemented by development partners, implementing partners supported by PEPFAR, Global Fund, and also domestic resources. Part of reaching adolescent girls and young women, going into schools, because we know also where it happens, at homes, and also attending to some of the social norms, engaging men and boys, the macho men who have money, who have often used their patriarchal power, you know, to really ensure that HIV is really transmitted as well. Now, the biggest issue or the gap that you're saying exists, it's about how do we intensify our efforts? How do we make sure the funds available or resources available are maximized? We need to go down to local level. We need to go down to where it matters, which is implementation spaces. Luckily, our NSP implements that. And we then go into provinces. We've got provincial implementation plans. And we've set targets in each province, in each district. These are targets that must be reached. We must address the key and vulnerable population, so which means we cannot leave anyone behind. It is very crucial that we do so. It is very crucial that we know our epidemic and what needs to be done. The community efforts that are done and led by community workers, community groups, local organizations, those are the efforts we must intensify. All of this can't happen without a functional health system. Health system comes at a point of a response, but at the same time, it's also about how do we teach our community of literacy around human rights, literacy around treatment, literacy around prevention. All of these key aspects can only be led by community effort. So which then means the health system and the community system must work hand in hand. We cannot shy away from the idea that local organizations are the solutions to this problem.